Good afternoon, everyone, speakers, panelists, and participants, and good morning and good evening to those based outside the Philippines. Thank you for joining our activity this morning, the Forum on Breastfeeding, First Food Systems and Corporate Power, a case study on the market and political practices of the transnational baby food industry and public health resistance in the Philippines. I am your MC for this afternoon, Dr. Aina Castro, of the Nutrition Center of the Philippines. The Nutrition Center of the Philippines is a member of the Philippine Coalition of Advocates for Nutrition Security, or PhilCan, which is co-sponsoring this forum with Alive and Thrive Southeast Asia. We have a stimulating afternoon ahead of us and hope you participate actively in the discussion. This forum this afternoon aims to disseminate the results of the study published in the Globalization and Health Journal by authors from Deakin University, the Philippine Department of Health, Alive and Thrive, and other partners, entitled Breastfeeding, First Food Systems and Corporate Power. Also, it also aims to contribute to increasing stakeholders' awareness on the market and political strategies used by the baby food industry to promote and sustain commercial milk formula consumption. And lastly, we also aim through this forum to highlight the importance of mobilizing breastfeeding coalitions, advocacy groups, and mothers in strengthening and protecting national breastfeeding policy frameworks and in implementing the Philippine Milk Code. Our audience this afternoon is comprised of representatives from government agencies at the national, regional, and local levels, health and nutrition advocates, medical and allied health professionals and students, and mother support groups. In posting about this forum on social media, please use the hashtag #EndExploitative in support of the WHO and UNICEF open letter to end exploitative marketing practices by the $55 billion formula milk industry. So maybe I'll request Janice to write the hashtag in the chat box. Please use the Q&A box for any questions. Please indicate also if your question is directed at a particular speaker or panelist. Let's leave the chat box free for any announcements, greetings, and your reactions to the presentations. Okay. So to formally open this forum and welcome you, may I call on the National Director of World Vision Development Foundation Philippines and lead convener of the Philippine Coalition of Advocates for Nutrition Security, or PhilCan, Mr. Romel Fuerte. Mr. Fuerte, the floor is yours.
Maraming salamat, Dr. Aina, for that, for opening our forum this afternoon. Magandang hapon sa ating lahat. Good afternoon, everyone, wherever you are at this time. A very warm welcome to this very important event. As mentioned, the Dissemination Forum on Breastfeeding, First Food Systems, and Corporate Power, a case study on the market and political practices of the transnational baby food industry and public health resistance in the Philippines. And on behalf of the Philippine Coalition of Advocates for Nutrition Security, or PhilCan, together with Alive and Thrive, we would like to express our heartfelt gratitude to all our speakers and panelists this afternoon. We also would like to acknowledge and thank all our colleagues from PhilCan, our partners from the Department of Health, various local and international institutions, and all advocates of breastfeeding and health and nutrition for our children. This afternoon, today, we will once again highlight the crucial role of breastfeeding coalitions, advocacy groups, and especially mothers in continuously strengthening and protecting the national breastfeeding policy frameworks and code implementation. We hope that this afternoon's forum will even broaden our awareness and deepen our understanding in upholding the well-being of children, our future generations. It is our prayer that may we remain committed to this privilege of helping children enjoy good health and thrive in their homes and communities, especially during this time. Again, a warm welcome to each of you to our forum this afternoon, and maraming salamat for joining us. May God bless you all. Back to you, Dr. Aina.
Thank you, Sir Rommel. So now we go straight to the meat of this afternoon's discussion. We start with the presentation of the study by Dr. Philip Baker. Dr. Philip Baker is a senior lecturer at Deakin University in Melbourne, Australia. He has a PhD from the National Centre for Epidemiology and Population Health, Australian National University. His research focuses on understanding global food systems change and the implications for human and planetary health. Recent work covers the global rise of ultra-processed foods, the political economy of food systems, and the commercial determinants of infant and young child nutrition. He has regularly consulted to United Nations nutrition agencies, was recently a member of the Global Nutrition Report's Independent Expert Group, and a fellow of the Lancet Commission on Obesity. Dr. Baker teaches high enrolling units on international nutrition and food policy and regulation at the Institute for Physical Activity and Nutrition, School of Exercise and Nutrition Sciences of Deakin University. Without further ado, I pass on the floor to Dr. Philip Baker.
Thank you very much, Ina, for that lovely introduction. And can I just confirm before I start that you can now see my title slide of my presentation?
Yes, we can see it clearly, Dr. Phil.
Thank you. Thank you very much. Well, first of all, thank you so much to Phil Ken, to Alive and Thrive, to colleagues at World Vision and other NGOs and organizations in the Philippines for the opportunity to present this research today. The Philippines is a country that is close to my heart. I have some very fond memories of visiting Manila and other parts of the country. And this research is essentially motivated by a willingness and a commitment to improve the health and nutrition of Filipino mothers and children, and to the benefit of Filipino society as a whole. I'd just like to start with some acknowledgement. This work was funded by the Department of Maternal, Newborn, Child and Adolescent Health of the World Health Organization. It's the result of a joint effort of an international team, and I must thank my colleagues, Paul and Roger at Alive and Thrive, FHI 360, and Maria and Anna at the Philippines Department of Health, and also Melissa Milon and David McCoy, and other colleagues who I haven't mentioned but have been very important to this work. And I know Julie Smith, for example, is on the call as well today. I'd just like to also say I have no conflicts of interest. I have no financial relationships with any commercial entity, and especially not the baby food industry. So I'd like to start this presentation by pointing you to our recent publications on this topic. This is all work that was funded by WHO. We've published a series of publications over the last 2 years, 2 to 3 years, I should say. All of these publications are open access. You can just search for them on Google and find them very easily online if you'd like to read more. It's not just about the Philippines. We also have case studies from other countries. We also have review articles, and we also have a few articles looking at this issue more from a global perspective, including influence at Codex at the World Health Organization and the World Trade Organization. But today I'd like to I'm really presenting and focusing in on the results of this paper here, which was introduced earlier, which is this really in-depth case study on the Philippines. But first of all, we cannot talk about this issue without talking about breastfeeding women and the importance of breastfeeding for its sustainable development. Breastfeeding is an on-demand biocultural food production system. So we are framing it in our research as a food, as part of the food system. It's arguably the shortest food supply chain on earth, unparalleled in safety. Nearly all of us will know the immense benefit that that breastfeeding provides, delivering optimal nutrition and immunological factors, responding to the child's evolving developmental needs. It's a crucial food source. I think this is under-recognized in low and middle income countries. Average breast milk intake between 1 and 2 years of age is about half a kilogram a day, providing about 35 to 40% of the child's energy needs. So this is a very, also extremely important for food security and not just nutrition. It's a staple food source. It's literally packaged with love. Breastfeeding fosters mother-child bonding, reduces stress for both, helps the mother regain pre-birth weight, contributes to birth spacing, which is important for family planning, and it's highly sustainable, requiring only small amounts of additional food. I think it's also important to clarify that breastfeeding is not free. It is done at the expense of woman's time and care work. It is a form of caring work, and I think it's under-recognized and undervalued by policymakers in nearly all countries, and it needs to be much more valued as a form of work, as a form of food production, as a form of care, and an expression of love by policymakers. Yet despite all these remarkable benefits, according to the latest Unicef estimate, less than half of newborns initiate breastfeeding in the first hour of life, exclusively breastfeed to 6 months of age, and continue to breastfeed at 2 years of age. And these are the WHO recommendations for optimal early life nutrition. I'd also, of course, just like to highlight and emphasize, underscore the importance of the opportunity that breastfeeding represents for the Philippines. The global breastfeeding target set by the World Health Assembly is 50% exclusive breastfeeding by 2025. The Global Breastfeeding Collective sets a new target of 70%. The latest data from the Philippines indicates that the 34% prevalence of exclusive breastfeeding, so well below the 50% target for 2025. Early initiation is better at 54%, but again, still much lower than what it could be. So if we can envision a Filipino society where all children and all mothers are able to breastfeed, if breastfeeding practices if breastfeeding was scaled up to near universal levels and supported and protected, this could prevent close to 9,000 children's deaths. I should say deaths in children under 5. So this is not a trivial issue. This is actually talking about saving babies' lives. It's just easy to sort of say, breastfeeding is, it's women's business. It's just something that, it's a responsibility of the family. It's not just that. It's a whole of society responsibility, and it has a massive impact on society in this way. Not just children's mortality, but also it has potential to reduce maternal deaths, about 2,000 annually from cancers and type 2 diabetes. It could save up to $16 million in health system treatment costs, and generate an additional $3.8 billion for the Filipino economy, or about just over 1% of the Philippines' gross national income. And this is largely because of the benefits for increasing children's cognitive capacity. So increased learning at school, increased performance at work. Breastfeeding had these huge systemic, society-wide impacts on productivity. And of course, it would reduce families out of pocket expenditures to treat diseases like or conditions like diarrhea and pneumonia, which can result from using commercial milk formulas. I should also say that the immense opportunity is to divert the expenditure somewhere between $600 and $800 million a year that Filipino families spend on commercial milk formulas could be diverted to other sustainable forms of expenditure, education, healthcare, and nutritious food, for example. So there is this big diversion of expenditure going to formula that doesn't need to. As background, is this wider motivation for understanding this, or for this work, which is to understand the global rise of commercial milk formulas. So these products were invented in the 1860s in Europe. They have since been transformed into a mass-produced consumer good available in nearly all countries everywhere. The market was valued at about US $1.5 billion in 1978. That's just before the International Code of Marketing was adopted in 1981. Despite the code coming in in 1981, the market expanded to 4 billion by 1983, and then it kept expanding until the latest figures we have indicate that it was approximating about $55 billion in worldwide sales in 2019. So this is the remarkable rise of commercial milk formulas, and we frame it as the displacement of breastfeeding by commercial, which is a biocultural food production system with commercial supply chains across a widening scope of mother-child population. So as the formula industry has spread around the world, more and more breastfeeding has been displaced by these commercial milk formulas, which relate to the supply chains and the marketing practices of the industry. We also frame this as unprecedented in scale. Arguably, there has not been a change in human history in the diets of infants and young children that is this remarkable, especially because this transition to higher formula diets is occurring mostly in highly populated middle-income countries. The figure on the right shows changes in world market value and volumes of commercial milk formulas, standard, follow-on, toddler, and special formulas. The image on the lower left shows the different types of formula categories. So today you can, there are maternal milks for pregnant women, for lactating women. There's standard formula for 0 to 6 months of age, follow-on formula for 6 to 13 months of age, toddler milks for 13 to 36 months of age, also sometimes called growing milks. What this image doesn't capture is also specialized or therapeutic milks, which are marketed for a small number of medical conditions. And I can say a bit more about that later on. Now, the implications of commercial milk formulas have been well described, and here we frame them more broadly in terms of health, but here we describe them more broadly in terms of the implications for sustainable development. So the implications for child and maternal health have been well described. I won't read these out because there's just too much to list here. But a long-standing literature on this topic, it was the subject of the 2016 Lancet Breastfeeding series, which used the term not breastfeeding, and the implications for neonate infant and child health. Also implications for food security, like I mentioned, breastfeeding is a crucial food source in all country contexts. Is disruptions to physical supply and implications during emergencies and crises can have remarkable effects, negative effects on the health of infants and young children. But also these wider implications for economic development. I already mentioned the economic cost for the Philippines. This is more broadly equivalent to about $340 billion annually in terms of global economic losses resulting from not breastfeeding. There are also these significant implications for the environment, and I think this is an under-recognized and neglected dimension of this challenge. The wasted resources, the expenditure, the physical resources, the ingredients, the packaging, everything that goes into manufacturing follow-up and toddler milks is a waste of resources, environmental resources, because WHO has long recognized that these products are unnecessary and even unsuitable for early life diets. So these toddler milks are particularly problematic from an environmental perspective. And that's not to mention greenhouse gas emissions, water pollution, and packaging waste. Okay, so the focus of the global health community has really been on this question of what are the harms or what impacts does commercial milk formula marketing or the marketing of breast milk substitutes have on breastfeeding. Now, the evidence is pretty clear that exposure to such marketing reduces breastfeeding initiation. It reduces breastfeeding duration, so how long breastfeeding continues for, exclusivity, whether breastfeeding occurs by itself or whether it's done with mixed feeding with formula or with other types of liquid foods. And this is irrespective of country context, low, middle, high income countries. 3 major strategies used by the industry: medical marketing, engagement with health professionals to secure the recommendation. Parents trust medical professionals. The industry knows this. They try to convince or use medical professionals to promote their products. and they do so very effectively, and there's been a lot written on this topic. Strategy 2, direct-to-consumer advertising. Advertising in traditional media like television, billboards, other forms of print media, but also increasingly using sophisticated forms of digital marketing through social media, which is highly targeted at individual mothers and parents. And there's been some really remarkable research done by colleagues recently, a major new report just published, which I'll say a bit about in a moment on this. And the third is product strategies, cross-promotion, claims, health claims, nutrition claims, structure function claims on the products, which are really to convince or portray this image that these formulas are comparable or equivalent to, or even many parents believe superior to breast milk, when in fact they are far from so. This is the report that I just mentioned, WHO Unicef report, interviews with over 8,000 women from 8 different countries on how the marketing of milk formula influences decisions on infant feeding. I'd highly recommend reading this report. So this all sort of comes to this, the International Code of Marketing of Breast Milk Substitutes, adopted in 1981 by the World Health Assembly. There have since been 20 World Health Assembly resolutions to update and strengthen it. It's one of 30 such codes guidelines adopted across the UN at the time in response to growing power of transnational corporations. So it is a direct response to the growing corporate power over infant and young child feeding. But as of 2020, 70% of countries had adopted at least some provisions of the Code international law. However, just 25 or 13% had laws substantially aligned with the code. So almost have fully implemented the code. So it's just 13% of countries. 58 countries, or 30%, had no provisions of the code in national law whatsoever. And so why, 40 years after the international code was adopted, is there so far to go in terms of its worldwide implementation? You wouldn't think we would need to convince and compel governments around the world to adopt these provisions into national laws, but we really do, 40 years later, have a long way to go. Now, the Philippine response has been an exemplar, and the Philippine people and the government should be applauded for their work in this area. The Philippines was influential in generating international support for the adoption of the code back in the late 1970s. Speech by Navidad Clavano in 1978, the famous Kennedy hearings convened in the United States Senate, was very compelling, talking about the experiences of interventions in the hospital. The Philippines is recognized as the lighthouse country. It's one of only 25 countries whose milk code law and supporting policies are substantially aligned with the code. It's been updated through revisions to the implementing rules and regulations administered by the Department of Health and an interagency committee. And in 2005 and 2009, the UN Committee on the Rights of the Child expressed serious concern for breastfeeding rates in the Philippines and called for stronger implementation and enforcement of the country's milk code. So it's a very brief introduction to the Filipino response. So what did we do in this study? Well, our aim was to understand the market and political practices of the baby food industry in the Philippines. And we were interested in 3 questions. What strategies and tactics has the baby food industry used to drive and sustain milk formula consumption in the country? How has the Philippines resisted and overcome the power of the industry to establish a world-leading breastfeeding protection law? How can this inform new modalities of public health action for breastfeeding in the country? We used a case study design, a process tracing method. We collected extensive documentary evidence, hundreds of documents, and conducted interviews with 17 informants. Those informants were from government, civil society groups, academia, and industry. There were a number of participants who declined to participate. Some of those were from industry, colleagues from the World Health Organization. I didn't get a chance. I had no response from WHO colleagues, WIPRO and the country office, and also no response from several government and academic informants. But essentially, we described the history of the issue, we drew from academic articles, media articles, policy documents, emails and letters, including extensive emails and letters between industry and government. And this was the paper that we produced, which you can easily access online. So this first question, what strategies and tactics has the baby food industry used to drive and sustain milk formula consumption? Well, first of all, we looked at the marketing strategies of the baby food industry in the Philippines. Okay, and so we couldn't really find much data on how much the industry has been spending on marketing, but in 2006 and 2007, that figure was an estimated 85 to 100 million US dollars, which was approximating about half the annual budget of the Department of Health. I should say that Nestle, the largest baby food industry company in the world, has an annual marketing spend of about $9 billion, which is nearly double the biannual budget of the World Health Organization. So these are remarkable marketing budgets. In 2011, 59% of mothers recalled having seen a CMF advertisement, and if they had seen one, they were more than twice as likely to use commercial milk formulas and have a 6-fold greater likelihood of breastfeeding cessation before 12 months of age. So CMF marketing works to undermine breastfeeding. CMF sales boomed from 260 million in 2003 to 839 million this is in US dollars in 2020. What has been key to the growth of these sales has been a product diversification strategy. So sales of infant and follow-up formulas have declined each by about -6% between 2003 and 2020. But toddler milk sales and sales of specialized formulas, which are those therapeutic formulas for medical conditions, have increased 49% and 62% respectively. So massive, the real boom has come from these toddler and specialized formula milks. As good evidence, we found good evidence of medical marketing being extensive, including sponsorship of the Philippine Pediatric Society, attempted engagement with other health professional associations, and conflicts of interest in certain professional bodies. Okay, so in the paper, we described 3 major periods of corporate political activity of the baby food industry. This is what we call process tracing. We trace the history of the issue over time. So these 3 major periods, 2004 to 7, we identified attempts to weaken the milk code. This was what we called, or could be described as a very aggressive approach by the industry, lobbying especially against new implementing rules and regulations of the milk code when the Department of Health tried to strengthen it. And this was coordinated through the Pharmaceutical and Healthcare Association of the Philippines, which was largely representing US pharmaceutical companies. And probably the most visible and aggressive action was a legal challenge in the Supreme Court of the Philippines, which I will talk about a little bit about later. Now, in 2007, there'd been by that point, the Pharmaceutical and Healthcare Association of the Philippines had really damaged its reputation, and I think there was I assume there was an attempt to distance by the companies to distance themselves from that reputation, and so a new lobby group was established, the Infant and Pediatric Nutrition Association of the Philippines. This included both US and European companies. So Nestle wasn't a part of the earlier lobby group, the Pharmaceutical and Healthcare Association, but it did then sign on and join these US companies in this new lobby group, the Infant and Pediatric Nutrition Association. The lobbying against new implementing rules and regulations continued, but the activities were more stealthy, more lobbying and less visible, less publicly visible, although we did find quite extensive evidence of it. And there was an attempted introduction of what was called the Milk Monster Bill. And if the Milk Monster Bill had have passed in the Philippine into legislation, this would have had somewhat disastrous consequences for breastfeeding protection in the Philippines. Luckily, it did not pass, but this was a bill that got through very far advanced before it was quashed, and we didn't find direct evidence that the industry was pushing for the bill. However, the bill would have greatly benefited the baby food industry because of its many provisions winding back regulations and different parts of the country's national breastfeeding policy framework. Then we saw, so we called this a stealth performance, as the strategy was more stealthy. Then from 2000 onwards, we saw this sort of shift towards more corporate philanthropy, partnerships, attempts to engage in partnerships with government agencies, and the recruitment of government officials. And I'll show you more of what I mean by that later. And this can be called a strategy of appeasement. So we've gone from really strong aggression in the mid-2000s to more stealth and appeasement as overarching corporate strategies of influence. So, so what are the sort of summary factors that we can sort of say were the strategies of the industry? Well, first of all, was to establish these front groups that I've just mentioned, PHAP and IPNAP. And as I've said, they represent different companies. IPNAP is the more recent lobby group governed by Nestle and Abbott. And this is led by a former Department of Health employee and congressman, which is an example of what we call a revolving door strategy, which has been used by the baby food industry for decades. The recruitment of WHO officials and so on to essentially gain insider knowledge, access to decision makers and so on. I should say that that the motivation for establishing these front groups is that the companies do not want to do the lobbying themselves. They do not want to receive or generate any reputational damage to their own brands. So by establishing these lobby groups, they distance themselves from that reputational damage. Now, what I'm about to show you is that these lobby groups are just part of a much broader influence network that extends to many countries and internationally. This is a network diagram of the baby food industry's global lobbying network, which we published in this other paper here, published in the same journal, but it's looking at this more from a global perspective. And IPNAP is actually one of the red dots in this social network diagram. Now, we saw the influence of this global lobbying network in our study, because it wasn't just when the PHAP was lobbying against the new implementing rules and regulations. We saw them mobilize other industry groups in other countries and across the Southeast Asia region. We saw them engage with the US Chamber of Commerce, a really powerful US business lobby group, which directly lobbied to the president of the Philippines against the implementing rules and regulations. We saw the mobilization of a lobby group in the United States, which lobbied the Filipino embassy in Washington. It lobbied the chief of Unicef in New York. It lobbied, some of these groups lobbied the Unicef regional office, lobbied the WHO regional office as well. So this is all evidence that this lobbying activity is internationally coordinated, not just coordinated within the country, but also internationally. And so, you know, these lobby groups are really representing the interests of transnational corporations located in the United States and Europe. These are not Filipino corporations. These are not Filipino interests. These are transnational corporations in a very powerful transnational industry. The point I will make here is that this lobbying activity is a really important form of influence of the industry, and we see it extensively in our case study right through the timeline, lobbying congressmen, lobbying the chair of the committees on trade and health, lobbying the president, lobbying WHO, lobbying Unicef. We see this lobbying all throughout the system. So the industry has deep pockets and it can afford to pay lobbyists to do this kind of work. The other key strategy we saw is this these arguments that kept getting put forward by the industry and from the industry's supporters, where they really were leveraging their market power and what we called international capital mobility. So that's just a very academic way of saying that the industry says, we are important to investment, we are important to jobs, we are important to your economy. Therefore, if you regulate us, this will have negative consequences. So here are some quotes. For example, the revised implementing rules and regulations would have unintended negative consequences for investors' confidence in the predictability of business law in the Philippines. If regulations are susceptible to amendment without due process, the country's reputation as a stable and viable destination for investment is at risk. And this was a letter from the president of the US Chamber of Commerce to President Arroyo. And you can see a very similar argument from the Pharmaceutical and Health Association of the Philippines, the chairman of the Committee on Trade and Industry. The other messaging strategy that we were surprised to find, actually, and this was quite interesting, was emphasizing choice and women's empowerment. Now, we didn't see these arguments coming directly from industry groups. We saw them coming more from people in government who were supporting the industry. And interestingly, we found these arguments coming from certain congressmen and from certain civil society groups. And we couldn't find what was behind these statements. So we cannot directly connect them with the industry. However, they are very pro-industry positions. And what these do is they emphasize in this quote on the left, the fundamental rights of consumers, particularly lactating mothers, to information and freedom of choice. Freedom of choice is a basic right, not just as being as a consumer, but as an individual. So really using these rights-based arguments to promote freedom of marketing. And you can see these quotes on the right. That is framed in terms of women's rights, emphasizing the importance of informed choice, and empowering women. So, we call this a co-optation of a public narrative to advance commercial interests. What is an important point to make also is that these directly contradict with the actual human rights obligations of the Philippines under the Convention of the Rights of the Child. So those are the rights that matter to the Philippines, not these arguments about that are really being construed to promote a commercial agenda. The other strategy, and I've talked about this already, was direct litigation and the threat of trade arbitration. So the legal action initiated against the Department of Health in the Supreme Court to block the revised implementing rules and regulations was, of course, one of the most highly visible commercial actions against the rights of women and children, arguably in the world. And I don't say that lightly. It resulted in a 398-day temporary restraining order against the implementing rules and regulations. And Paul Farmer, who you might know, who recently passed away, would have called this or described this as a form of structural violence against the child because of the potentially thousands of deaths that could have occurred while the temporary restraining order was in place. The other strategy has been this emphasis on the Philippines' obligations under the WTO's TBT, Technical Barriers to Trade and TRIPS agreements. So saying you have these obligations under WTO rules, these regulations contradict those obligations. And we saw these arguments being used very frequently. And these arguments were refuted by the Filipino government's own lawyers, and also refuted by WHO and other experts. So these claims around contradictions with WTO obligations were essentially completely invalid. And WHO has and Unicef have issued a statement on this as well. Now, more recently, we've seen this shift towards more of an appeasement strategy, and this is forging partnerships and government connections. And we found evidence of attempted memorandums of understanding with the Department of Health, and some with the Food and Nutrition Research Institute, Department of Social Welfare and Development. So not extensive partnerships, but certainly attempts at forging them. And then in 2018, this establishment of an IPNAP ethics committee, recruiting former health secretary, former health undersecretary, and former trade undersecretary, as well as a pediatrician and former Miss Universe Philippines. And so, this is essentially what is called a co-op, a revolving door strategy, where you go out and you actively recruit people with influence, people with inside knowledge, to gain access, to gain credibility, to frame the industry as a good corporate citizen, when we know, in fact, that the industry is doing all sorts of engaging in all sorts of harmful practices. So how has the Philippines resisted and overcome the power of the industry to establish a world-leading breastfeeding protection law? Well, I should say that the Milk Code is just one of a number of components of the country's national breastfeeding policy framework. And since the 1980s, the good news is that breastfeeding rates have been increasing in the Philippines. And this largely reflects, or at least to a significant extent reflects, this emerging political commitment for breastfeeding and the strengthening of this national policy framework. This policy framework is sacred. I mean, it is essential in protecting the rights of women and children in the Philippines. And full credit to the government, to advocates, to others in the country for having achieved this remarkable outcome. It didn't emerge through a lot of hard work. I think, always inspiring doing these studies to learn about the immense efforts at building breastfeeding coalitions and the advocacy that has gone into this. So I just start by saying these breastfeeding coalitions that have mobilized around the Milk Code, around the National Breastfeeding Policy Framework, have been quite cohesive, at times cohesive and influential. Often centering on the Department of Health, so other government agencies, Unicef, WHO, national and international NGOs. And this can be considered a social lobby for breastfeeding, and it has effectively actively countered industry influence. It underscores the importance of sustaining and indeed strengthening this coalition, and continuing financial support for it, and also for the norm promotion, technical and advocacy work of WHO, UNICEF, and partners in the country. And although this does depend on staff priorities, leadership, and capacities of these organisations, and whether or not this coalition, the strength of this coalition now, and how we can strengthen it going forward is the really interesting question. The other is civil society mobilization and transnational activism. So civil society groups, breastfeeding champions, health professional societies, journalists, and at times large numbers of mothers themselves have mobilized collectively in response to industry attempts to weaken the Milk Code. Very visible protests at times outside the Supreme Court, large mass breastfeeding events, and many other examples of this advocacy and activism. And it's been really important in terms of raising the salience and the visibility of the issue in the country. This has been coupled with transnational activism, coupled around the International Baby Food Action Network, World Baby Milk Action, and other international advocacy groups. And I should say that that is also very much a reflection of the combined technical and moral power of breastfeeding advocacy. So the issue has really reached an emotional plane in the Philippines and maintained salience or awareness. And that's, partly a reflection of using these compelling evidence-based arguments for breastfeeding, drawing from well-established international standards and scientific knowledge, but also making, and of equal importance, messages based around these moral arguments concerning the rights of the mother and child, the protection of the innocent from commercial harm. So I just want to make that point really clear. It's not just about evidence. It's about morals and it's about rights. And if we couple evidence-based arguments with the moral power of doing the right thing, that's a powerful combination and has been a powerful combination. I also just mentioned that there's a lot of research on this. How do we continue to generate commitment for breastfeeding? The breastfeeding care model, lots of great materials from Unicef, Save the Children, and in the academic literature. And these are some conclusions and future actions and discussion points. I won't read these out, but they're just some questions that came to mind having completed this research that we could, I just really here for discussion and reflection. And you're welcome to have my slides if you'd like to engage with these questions at a later point. So thank you very much. And I've gone over time, I apologize.
Thank you, Dr. Baker, for the very illuminating presentation.
Pleasure.
I really appreciate the volume of documentary evidence that you had to read through for this case study. But I found especially interesting the collation of evidence of lobbying directed at the highest levels of the executive and legislative branches of government. The article is really a good and interesting read, so I encourage the participants who have not yet read the article to read and to share it. I think Paul has posted the link in the chat box. So please feel free to read the article. Currently, we have 100 participants. Yeah, and for those who joined us late, this meeting is being recorded and the link will be shared subsequently. I'd like to invite the participants to just write your questions in the question and answer box. And we will try to answer as many questions as possible during the Q&A session later on. You can also write your reactions in the chat box. Okay, so again, thank you, Dr. Baker. We'll get back to you later for questions during the Q&A session. Okay, so now we proceed to the presentation of the statement from the Department of Health. We have a recorded video from Dr. Maria Rosario Singh Vergeire. Dr. Maria Rosario Singh Vergeire is the current Undersecretary for the Public Health Services team and the official spokesperson of the department, and no stranger to all of us. She was previously the officer in charge, Undersecretary for Health Regulation team, and Assistant Secretary in charge of the Public Health Services team. She also acted as OIC, Deputy Director General of the Field Regulatory Operation of the Food and Drug Administration, Office Director of the Health Facilities and Services Regulatory Bureau, and Chief of the Health Research Division of the Health Policy Development and Planning Bureau. Undersecretary Vergeire has committed decades to public service, having worked in the Marikina City's Health Office before joining the Department of Health in 2007. Aside from public service, she's also committed to nurturing our soon-to-be public health leaders, serving as faculty at the Development Academy of the Philippines and part-time faculty in the Ateneo School of Government. She obtained her undergraduate degree in zoology from the University of Santo Tomas, her medical degree from De La Salle University College of Medicine, and her master's in public health from the University of the Philippines, Manila. Let's all watch the recorded video of the statement from Dr. Vergeire.
Good afternoon to all of you. Thank you for inviting me as a speaker in today's forum. Let me also thank Dr. Paul Andrew Zambrano, Regional Technical Advisor of Southeast Asia Alive and Thrive, Ms. Janice Datu Sanguyo for all their hard work in organizing this event. Allow me to acknowledge Mr. Romel Fuerte, convener of the Philippine Coalition of Advocates for Nutrition Security, and Dr. Philip Baker of the Institute for Physical Activity and Nutrition at the Deakin University. The Department of Health wishes to extend its sincerest appreciation to the Alive and Thrive and the Philippine Coalition of Advocates for Nutrition Security for conducting this forum as we continue to champion for breastfeeding and its benefits to babies, mothers, communities, and the different sectors in our country. Today, we will discuss the commitments of the Department of Health towards building a mother and baby-friendly Philippines with the Philippine Milk Code and relating this with results of our study on breastfeeding, first food systems, and corporate power. One major concern in promoting child and maternal health, not only here in the Philippines but also globally, is the continued aggressive marketing of breast milk substitutes. As discussed thoroughly by Dr. Philip Baker, the baby food industry utilizes different intensive marketing and political practices in shaping the country's first food system and thus driving and sustaining the consumption of commercial milk formula. Despite that, there has been a continuing and rising political commitment for breastfeeding, further resisting the power of this industry. With this, there is a demonstrated need to safeguard the development of policies to protect, promote, and support breastfeeding from the baby food industry, as many countries have already done for tobacco control. Legislated in 2019, the Republic Act 11148, or the Health and Nutrition of the Mother and Baby Dyad, revolves around the reduction of stunting through the implementation of the Philippine Plan of Action for Nutrition, and one of its key components is the protection, promotion, and support of breastfeeding and critical infant and young child feeding, or IYCF practices, through the implementation of the International Code of Marketing for Breast Milk Substitutes, which the Philippines has adopted in 1986 as Executive Order 51 of the 1986 or the Philippine Milk Code. The Philippine government recognizes and highly prioritizes the first 1,000 days of life as the critical window period to establish a strong physical and psychosocial foundation for Filipino children, as well as the health and well-being of our mothers before, during, and after giving birth. RA 11148 engages civil society organizations and non-government organizations as key stakeholders and actors in progressing movements on nutrition governance, systems financing, human resource development, service delivery standards, and most importantly, enforcement of systems regulations in all aspects of these pillars of the healthcare system. The Milk Code indisputably is a very important law. Its enforcement is specifically included as one of the 5 major components of the Infant and Young Child Feeding Program. The Infant and Young Child Feeding Program is one of the 21 major programs in the Philippine Plan of Action for Nutrition 2017 to 2022, which is an integral part of the Philippine Development Plan. In order to protect and promote breastfeeding and appropriate infant and young child nutrition, several parallel and interrelated multi-sectoral programs are being conducted in the Philippines. Apart from the Infant and Young Child Feeding Program, we also have the Mother Baby Friendly Hospital Program, promotion and support for breastfeeding in the workplace, and the establishment of the community-based support groups to ensure continuation of breastfeeding after discharge from the hospital. The core principle around these interventions is the enforcement of the Philippine Milk Code, which ensures that the system is protected from the participation of corporations that capitalize on the use of the healthcare system and its healthcare workers to increase profits. An effective implementation of the Milk Code is vital in ensuring the protection and promotion of breastfeeding and appropriate infant and young child nutrition. On the other hand, an ineffective implementation will definitely have serious adverse impacts on the related interventions, including those for reduction of malnutrition and stunting in the Philippines. 36 years after its legislation, the Philippines' exclusive breastfeeding rates for children under 6 months old progressed from 24.7% in 2015 to 32.1% in 2019, increasing by around 30%. It has to be noted that we are still around 18 percentage points away from the global target of 50%. The protection, promotion, and support of breastfeeding is important now more than ever, not just for reaching the global target, but also to contribute to the reduction of stunting and malnutrition in the country, which has stagnated at 24% in 2019 from 20% in 2007, as well as contributing to food security for children below 2 years of age. As for complementary feeding, we see that 52% of Filipino children's diets rely on commercial baby food, also providing a picture on the poor public uptake of the government's recommendations on complementary feeding. While efforts on behavioral change through public health interventions are in the pipeline for strengthening primary healthcare services in the country, complementary foods accessed by the public have to adhere to a standard nutrient profile. It is not enough that only a portion of the available commercial food in the market for children 6 to 36 months old serve the nutritional needs of our children. The Nutrition Center of the Philippines and Access to Nutrition Initiative reports that the baby food market in the Philippines is continuously growing, marking a 6% growth from 2016 to 2020, with 95% of this made up of just breast milk substitutes and milk formula. The 2021 Access to Nutrition Initiative report showed that only 36% of local and imported food marketed as suitable for the said age group adheres to the WHO European Nutrient Profile Model. As we continue to elevate the status of infant and young child feeding program, it is important to recognize our partners in championing for breastfeeding. We are extremely proud that the Philippine Milk Code was initiated by organized Filipino mothers. The 2007 challenge from the industry on its revised implementing rules and regulations has taught us via our Supreme Court that the Department of Health holds the reins in ensuring that policies, standards, and regulations have the best interest of Filipinos' health in mind. The legislation underpins RA 11148 to ensure that the regulation of information on breastfeeding, as well as proper and sustainable nutrition, is supported by education and services for mothers, children, and adolescents within the nurturing care framework. In line with this, let us review the different challenges we face in our battle for national implementation. The DOH is the implementer of these laws, but the decentralized structure of our healthcare system makes implementation a challenge in itself. It is subject to the priorities of our local government units, which serves in limited terms, and only a small number of health and community development workers are tenured. The second challenge involves raising awareness among the public and the private sector on the Philippine Milk Code. It is crucial that families, health and community workers, legislators, firms, and institutions are aware of these laws. Awareness is the key to strengthening public and private sector response to the protection, promotion, and support of the code and the infant and young child feeding practices. Yet, this is still a challenge after almost 35 years. Setbacks, including natural disasters, the loss of key family members to unstable political climate, and the COVID-19 pandemic displaced multiple families, caused income loss, and further launched them into hunger and poor health. These have heightened the need for infant and young child feeding and milk code information and education campaigns and strategies to equip the public and the private sector in their role as active implementers. Calls for infant formula donations and unsupervised community distribution of milk formula peaked during the beginning of the lockdown and is still happening now, 2 years into the pandemic. This was a test not only for the implementation of the Milk Code and the RA 11148, but also on the effectiveness of our administration and service delivery and nutrition services. The third challenge is the growing baby food industry in our country. Between 2016 to 2020, it grew by 6%, and milk formula accounted for 95% of that growth. The 2021 Access to Nutrition Initiative report showed non-compliance among major industry players in the Philippines. marketing restrictions on breast milk substitutes as detailed by the International Code, World Health Assembly resolutions, and the Philippine Milk Code were and are still being flouted. Marketing regulations that apply to web-based platforms for communication and retail, and rules on labeling and packaging for the Philippine Milk Code scope-covered products, including the practice of cross-promotion, are already included in the current policies that have materialized before 2010. And the clarificatory policies, active education and advocacy, and enforcement of standards, monitoring and feedback that we are issuing shall address this, among others. We acknowledge that without any of this, the enforcement of the Philippine Milk Code shall remain subpar and vulnerable to conflicts of interest during policy making, implementation, and the monitoring process. These are our deliveries for strengthening the Milk Code and the Filipino families for 2022 to 2025. And this clarification of the current rules and strengthening of the monitoring and enforcement strategy seeks participation across all public and private sectors, including civil societies. Enforcement and maximizing the policing power of the health sector remains to be a challenge. 35 years, and we still encounter the same reasons for milk code violations. Non-awareness of regulations on the use of health infrastructure and the general public as channels for marketing, and misinformation among players and representatives who believe that their interactions do not constitute conflicts of interest. To address this, the DOH is working with key implementing agencies, the Department of Trade and Industry, the Department of Social Welfare and Development, the Department of Justice, with technical assistance from Unicef, and collaboration with stakeholders to develop the National Action Plan for the implementation of the Philippine Milk Code. Expected to be released before the end of the second quarter, the National Action Plan is developed in order to ensure an effective implementation and monitoring of the Milk Code and its implementing rules and regulations. It identifies strategies that are directed towards improving systems for effective implementation, monitoring, enforcement, policy support, and standard setting, and mobilizing and involving stakeholders. This National Action Plan also developed for integration into the Omnibus Guidelines for Adolescents and Reproductive Age and Children and the Disease Prevention and Control Bureau's Primary Care Strategic Plan. The response of our healthcare sector must meet the evolving landscape of the industry and the governance. We recognize the importance of collaboration between the public and the private sectors, but partnerships must focus on the goal of protecting public health and welfare. We are strengthening coordination with our regional offices, key national and local government partners, health facilities and workers, and mother support groups. Our training and interactions have become the basis to restructure our code advocacy, enforcement, monitoring, and public feedback system. The clarification of code rules has begun with the DOH Department Circular 0217 in the year 2020, which reiterates restrictions on donation of baby food, bottles, and teats, and calls for carefully planned local government assistance to vulnerable mothers and children during crisis, and discourages donations of goods covered by the scope of the code. We are now moving toward more inclusive regulations that engage the public and private sectors, including the industry, to ensure that our regulatory processes are not a mystery and that marketing regulations also apply to corporate social responsibility activities prone to becoming marketing opportunities. With this, we maintain that the industry and its representatives shall not be part of the policy-making and decision-making processes concerning public health. While we have opened an avenue for reporting violations on the Milk Code and the rights of mothers to receive maternal and child health services, we shall be developing a separate interface with the industry to coordinate code compliance in the market and in times of disasters and emergencies. This will be my last slide. The physiological to economic benefits of breastfeeding practices makes the cause a worthy investment. Thus, we call on the academe, professional organizations, medical and allied healthcare sectors to heed our imploration not to allow corporate interests to influence the standards of care that we should be delivering to our Filipino mothers and children. To the women support groups, civil society organizations, development partners, the academe, professional organizations, and other sectors present with us, you are key actors in investing in a healthcare system that wholly protects, promotes, and supports proper infant and young child feeding practices that is free from any form of direct or indirect conflicts of interest. This ensures the delivery of quality and nutrition services that takes care of the health of our mothers, babies, and children. The Philippine Milk Code is a regulation that regards sustainable development goals on eliminating poverty and hunger as the rest of the world through investing in women and children in the correct areas of intervention, from workplaces, healthcare institutions, homes, and also evacuation areas, and the protection of the integrity of the health sector and its health personnel, focusing our interest in service by standards and regulations set by government without seeking corporate rewards. Maraming salamat po at mabuhay tayong lahat. Let us all continue to work hand in hand in promoting a mother and baby-friendly Philippines.
Thank you very much, DOH and USEC per hearing for explaining the commitments, the recent efforts of the DOH to support code implementation and the future commitments of DOH, especially under RA 11148 and the National Action Plan for the Milk Code, and your efforts, overall efforts of working towards a mother and baby friendly Philippines. Our next session is a panel discussion to be followed by a question and answer session. So I'll introduce the moderator of the panel discussion and the Q&A session, Dr. Maria Asuncion Silvestre, or Doc Mian as we fondly call her, is a pediatrician who completed clinical and research fellowships in neonatal perinatal medicine or neonatology at the Children's Hospital of Michigan and Huxell Hospital of the Detroit Medical Center and Wayne State University, Michigan. Upon return to the Philippines, she joined her alma mater, the University of the Philippines College of Medicine and its affiliate, Philippine General Hospital, and served there as associate professor and neonatologist. She committed herself to pushing breastfeeding into the core of pediatric education. She authored a chapter on infant and young child feeding in Fundamentals of Pediatrics, a textbook used widely in the Philippines. In 2010, she founded the nonprofit Kalusugan na Mag-ina Incorporated, or KMI, which translates to Health of Mother and Child in English, which is dedicated to the health of the mother-child dyad. With WHO Philippines, she collaborated on implementation of essential intrapartum and newborn care, or Unang Yakap, First Embrace, in 2008, which was a time-bound sequence of evidence-based life-saving interventions in the labor, delivery, and immediate postnatal period. As the First Embrace, the program is being implemented in at least 9 countries. She is currently a member of the Independent Review Group for Early Essential Newborn Care of the WHO Western Pacific Regional Office that reviews country data on EENC's quality improvement efforts in priority countries. KMI, with the support of Unicef Philippines, has been contributing significantly to the Philippines Department of Health capacity building and health financing efforts for the Philippine Integrated Management of Acute Malnutrition. With the Asia Pacific Center for Evidence-Based Healthcare, or APCEBH, Dr. Silvestre co-authored Painless Evidence-Based Medicine, the 2008 and 2017 editions, She has numerous research publications in peer-reviewed international journals. So I will call on Doc Mian to join me on the virtual stage while I introduce the first three panelists. Our first panelist is Dr. Beverly Lorraine Ho. Dr. Ho is the concurrent director for the Health Promotion Bureau and the Disease Prevention and Control Bureau at the Department of Health, Philippines. As HPB director, she leads risk communication, community engagement, and demand generation for COVID-19 vaccines. As DPCB director, she leads primary care integration of various health programs. Prior to this, she was chief of the research division of the Health Policy Development and Planning Bureau, where her efforts significantly contributed to the passage of key legislation on sugar-sweetened beverage tax, tobacco tax, and universal health care. Dr. Ho is a fellow of the Maurice Greenberg World Fellows Program at Yale University, the Equity Initiative, and the Atlantic Institute. She holds a medical degree from the University of the Philippines and a master's in public health in health policy and management from the Harvard T.H. Chan School of Public Health as a Fulbright Scholar. Our second panelist is Attorney Benedict Nisperos. Attorney Nisperos is a legal and policy consultant of different institutions, mainly by Health Justice Philippines. He is a licensed urban planner and a development economist. He holds a degree in business administration, a diploma in urban and regional planning, and also finished a Juris Doctor degree, all in UP Diliman. He was a Chevening Scholar, where he earned a master's degree in local economic development from the London School of Economics and Political Science. He was also a professional fellow of the Professional Fellowship Program of the U.S. State Department. He recently decided to pursue his PhD in Designed and Built Environment at UP Diliman. Our third panelist is Ms. Eileen Alcaraz. Ms. Alcaraz serves as the National Officer for Sexual and Reproductive Health and Rights, including HIV and AIDS, for the Asian Medical Students Association, Philippines. She's currently a fourth-year medical student, and as such, our youngest panelist at the University of the East Ramon Magsaysay Memorial Medical Center. As an AMSA officer, she spearheads various projects. Some of the most recent ones are the conduct of HIAO 2022, Arte, Empowered Women Empowers Humanity, Breast Start, or Breastfeeding is the Best Start to Life, and Sex Plus, Safer Sex, Sexual Hygiene, and COVID-19. She was also engaged as speaker and participated as a delegate to various conferences, including the following: Angels of the Asia Pacific, Sexual and Reproductive Health and Rights Issues Across Borders, the 70th General Assembly August Meeting 2021 of the International Federation of Medical Students Associations, and IFMSA Asia Pacific Regional Meeting. She's one of the authors of a research paper entitled An Analytical Cross-Sectional Study of the Knowledge, Attitudes, and Practices, or KAP, on biomedical waste management among nurses and medical technologists in the Philippines, which was awarded as the best presentation of a research paper in public health during the 2021 International Student Congress of Biomedical Science. So at this point, I will turn over the floor to Doc Mian for the first half of our panel discussion. Doc Mian?
Thank you, Doc Aina. Thank you, Doc Aina. I'm Mian Silvestre. Good to be with you this afternoon, and thank you for the introduction. Let's dive into the reactions from our panelists, and so that we can hopefully wind up a little past 3 o'clock. I'd like to call first on Director Beverly. Doc Bev?
Good afternoon, Mami Ann. Mami Ann is my first boss who introduced me to field work, on Unang Yakap. Magandang hapon po to everyone. We're very grateful to Philcan and Alive and Thrive for organizing this event and for the paper that has been published by our colleagues from Alive and Thrive and Beacon University. Indeed, it is good for a change, to be recognized for the work that is being done in the country, not really just by government, but really by the entire community, from academe, civil society groups, as well as development partners. But as with many things, they say that the Philippines is always good, in policy frameworks and in paper, but we always have difficulty. I won't say fail, but have very, very difficult time in implementation. And so our journey here in the DOH, the last few years with the advent of UHC law, has been to think about how to simplify. Um, in the past, the work on nutrition, for example, and breastfeeding is very much different from what we do for, say, HIV or TB, etc. And so the mindset is each program competes with another program. And we did think that that was actually one of the pitfalls, both in pushing forward the program in a more aggressive manner, but also in perhaps supporting implementation by our local government units in particular, let alone the private sector. So in terms of the commitment of UHC, we look at our two main roles, in terms of first, allowing or enabling people to take care of themselves and their family, and be protected from risk. So this is basically health promotion. And the other part of it is taking care of them when they need it, when the services are actually required for them. So for the first part on health promotion, what is clear to us is that there needs to be a shift in paradigm from a typical or the usual, let's give the information and things will follow. So it has been repeatedly emphasized in the presentation and in USEC's remarks that the social and behavior change is actually very, very important. So from merely putting the responsibility of, saying, doing breastfeeding on the person after assuming that we actually have given them the information, it is clear to us that in all our health promotion campaigns now, the setting part, or the policy framework around which that person moves is actually even more important. And that's where we, national, local governments, and even administrators of, say, workplaces and school actually come in and have a role to play. For the second part on providing services when people need them, this is where the omnibus guidelines that USEC has mentioned in her presentation comes in. We did a review of the technical standards that all our implementers on the ground will have to work on or will have to know and review. And lo and behold, our audit has shown that it's actually already numbering at 1,200 guidelines. 1,200, and it's only within our office. It just tells you that the way the standards that have been put forward are really pretty complicated for a narrow set or a few people who will actually be implementing them. And we haven't done our job well in terms of synthesizing this in a way that the implementers will actually find it easier to do, and which means that they don't have to look at each disease program or even each behavior as a specific program, but actually consider them as a whole set of things that are actually connected, and that they shouldn't be sifting through different, moving from one guideline to another, and going on different trainings, etc. It might be a little bit more distal yet, no, to actual implementation, but our current work in terms of streamlining the service provision standards is actually gearing towards more simplification and ease of implementation on the ground. And clearly, we do want to benefit how services like breastfeeding support will be completely embedded into a regular maternal and child health services on the ground, because now it is more an exception rather than rule, or you will typically not get it from your formal health system, but perhaps get it from mother's group, etc. And so I think I'll stop there and leave some more time for our other panelists and to discussion. But just to say that these two big items on health promotion and primary care reforms are perhaps our contribution for now in terms of pushing for better, fuller implementation of what has already been idealized in our legislations or policy framework. Thank you po. Mami Ann, over to you.
Thank you, Director Bev. Before we go to the next speaker, which is Attorney Benedict, let me just rewind a little by thanking Phil, Dr. Baker. Some of the questions might be just trickling in right now, so this is some sort of reminder to our participants from different stakeholder groups. It may seem a little bit overwhelming, the talk so far, but please do write in your questions into the Q&A box so that we can maybe combine them. I'd like to lament how something as fundamental as a mother nurturing her young can be embroiled in so much mind-boggling and heart-wrenching debate and debacle. So please don't be overwhelmed by the information, by all the information. But Dr. Bev just gave us a quick overview of how to maybe translate all the rhetoric and the moral discussions into actual translation to practice. So from that, let's go to Attorney Benedict. I think you're up next.
Yes. Good afternoon. Thank you very much for this opportunity. So when I was listening to Dr. Phil, I truly can relate, coming from the tobacco industry control advocacy, from the tobacco control advocacy. Health Justice is one of the civil society organizations that is involved in the tobacco control advocacy here in the Philippines, and I see similarities in his report with the way we have been engaging in tobacco control, and with the way the tobacco industry has been very aggressive in also influencing policies that control tobacco, especially now with the introduction of a new a novel tobacco product, which are vapes, which we are more familiar with. I prepared just minimum slides which I could show just to show a correlation on this. If you could let me share it. Okay, so as I said, we are from Health Justice, and from Health Justice, we do tobacco control advocacy. Some of the guests and members of this group we coordinate with closely, and I'd like to see parallelisms in terms of the tobacco industry interference and the milk industry interference as presented by Dr. Baker. So as we know, there's what we call big tobacco, which has a lot of money which it could use to advance its own interests in terms of policy that would let it freely be marketed, sold, and promoted to users and new users at that with the vape products. And we also have what we call tobacco industry in the tobacco control advocacy, where the tobacco industry uses its influence in terms of the implementation of the health policies, in terms of policy creation. And we know for a fact that the tobacco industry interference is the single biggest threat to how we control tobacco. The Philippines is a signatory to the Framework Convention Tobacco Control, and we are tasked to prevent any influence by the tobacco industry, not only by the industry, but also different organizations, individuals who work to further the interests of the tobacco industry. And as described by our presenter a while ago, the milk industry has its allies. It's the same way with the tobacco industry. We have those who manage and enhance the reputation of the tobacco industry. We have those who sow doubt and establish false science, as compared to objective science in terms of the use of tobacco and its effects. And there are those who enable suppression and information through the representation of legal representation and policy advocates and lobbyists in Congress. We see them often during policy hearings in Congress in both houses, and they're very open in terms of interacting with our legislators and on the legislative side, and even interacting with our project implementers and program implementers in the executive side. And there are also those who directly lobby and influence policymaking, and those who legitimize misinformation. And as we know, the tobacco industry lobby in the Philippines is one of the strongest, if not the strongest, in Asia. And as presented a while ago, there are many ways how this lobby is influencing policy here in the Philippines. For us, the most present ones are the vape legislation, which is a very popular and very pressing issue now, where we see a large presence of the tobacco industry, and also the revocation of a memorandum circular between the DOH and the Civil Service Commission that mandates the bureaucracy to prevent any interaction, not unnecessary interaction with the tobacco industry. And if they do need to interact with the tobacco industry, it needs documentation, and it should be well explained by the government offices. And these are the policy areas that we see an increasing influence by the tobacco industry. And they do this through donations, through their so-called corporate social responsibilities, fundings in different studies which are inclined to favor the tobacco industry, and other different efforts. And I'll just show you, these are the last slides, how the tobacco industry has been very active also in terms of influencing policies and programs here in the Philippines through donations and CSR activities, in different organizations within the bureaucracy, through offers of partnerships with the government agencies, through influencing lawmakers during deliberations on health measures, and bringing them, for example, outside of the country for, as we brand as junkets, for them to actually somehow learn. But we know for a fact that these are inclined to convince these lawmakers to favor their policies. And for example, their participation in hearings, they'd like to be participated when in fact there's already a rule on. So what, coming from the experience of the tobacco industry and learning also from the presentation a while ago in terms of the milk industry policy interference and interference also in the implementation of the rules on the milk code, we have come up with different best practices in countering the tobacco industry interference, like the adoption of policies that will prevent conflict of interest with the tobacco industry. And this should also be protected, like the JMC we have with the Civil Service Commission. And we have to reject policy drafts, and because they're very active in pushing for their own drafts that are favorable to them in terms of bills, in terms of ordinances at the local level, and also the rejection of the partnerships, which we know for a fact has strings attached. And then we have to expand our network and collaboration with other sectors who will support our advocacy. As for the tobacco industry, tobacco control advocacy, we have recently faced the corporate social responsibility bill that was presented in the House of Representatives and as a counterpart also at the Senate, where we almost, or I think it's still pending, but it's not so aggressive now, but the CSR would allow all types of corporate social responsibilities by different industries, even those that are harmful to public health, those are harmful to the environment. And it allows the greenwashing or whitewashing of these industries through corporate social responsibilities. And on the part of the advocacy, we have been aggressive also in coordinating with the different civil society organizations, not only from our advocacy on tobacco control, but also with the in terms of the milk code, in terms of those against mining, those against environment degradation, these industries that affect them. We were aggressive in asking for their support to counter this corporate social responsibilities, which allow bill which allows these harmful industries easy access to local government units to deceive and use this as a marketing ploy of their products. And finally, we have to raise awareness that there is what we call a industry interference, and it's very aggressive, it's real, it's palpable, it's tangible. We see it in how our government works in all branches of government, and we have to raise awareness about this, and we have to raise that the awareness should show that the deceitful intent of these industries and should convince our lawmakers to protect existing policies that are protective of public health, and also convince the public that we need to be protective of these measures. And yeah, that's all. Thank you.
Thank you, Attorney Ben. Attorney Ben raised the parallelisms between what's happening in the tobacco lobbies and the efforts to curb their industry. Many similarities exist, but also some fundamental differences between the products that are hindering our use of those practices to fight the lobbying. So I'll leave it at that for now, and I'd like to go to Miss Eileen. Eileen, are you good? Okay, thank you, Attorney Ben. Thank you for now. Miss Eileen, the floor is yours.
So good afternoon, everyone. Before I start, thank you again for organizing this event and for inviting AMSA Philippines to be part of this forum. So as a medical student and as an advocate for maternal health, it is actually my first time hearing about this issue. So one of the most impactful and eye-opening parts of the research is that there have been attempts to weaken the milk code through intensive PMS marketing, resulting to the decline in breastfeeding in the Philippines. As stated in the study, their marketing strategies include engagement with health professionals alongside direct-to-consumer advertising and widespread product distribution. This is alarming because health professionals are very influential and considered as one of the most respected and trusted members of the society. So in the event that these health professionals establish any form of partnership or collaboration with milk companies, the decision of pregnant women or parents of infants and young children to breastfeed or opt for breast milk substitute is greatly affected. So these marketing tactics may enable health professionals to discourage them from breastfeeding, since the capability of women to breastfeed is now explicitly surrounded with doubts and misinformed choices. So as a medical student and future doctor of my patients, we have a role in providing evidence-based and an independent advice on the health decisions of our patients who express their trust on us. Thus, we, medical professionals, have better understanding of breastfeeding and its benefits, and we must not allow milk companies to make us part of their marketing strategies in convincing pregnant women and parents of young children on the need for formula milk. I would also like to emphasize on the importance of the capability to make an informed choice. So in this study, it was mentioned that formula samples are widely distributed to public and private hospitals, and approximately 80% of it is distributed to the patients. In addition to this, their exposure to the marketing of wide range of formula milk products is associated with the thought that formula milks are essential for older infants, possibly presenting a message that the quality of breast milk lowers over time. So going back to the importance of making a choice, opting for formula milk must not be solely based on free samples, recommendations by medical professionals, or engaging advertisements and packaging. Again, this choice must be evidence-based and independent. As medical professionals, we have a part in helping our patients make an evidence-based and informed choice, since our knowledge on the importance of breastfeeding, the medical and social barriers to breastfeeding, and when to resort to formula milk will greatly impact our patients' attitudes and practices. We must be firm on what we advocate for and what is ethical because we simply want the best for our patients. And this best must not be based on marketing strategies, but rather on independent and informed decision making. Thank you so much.
Maraming salamat, Eileen. I envy you because when I was a medical student, I was born into a culture of these marketing practices to the point that, as one neonatologist put it, fish cannot see water because we were so immersed in that culture of marketing that we couldn't see straight and we didn't know that it was wrong. So thank you, Eileen. I'm going to temporarily turn over to Doc Aina to introduce our next two speakers, our next two panelists. Thank you, Eileen. Doc Aina.
Thank you, Doc Mian. Yes, so our next two panelists are from the WHO and Unicef. Mr. Eugene Arbis is a registered nurse and midwife with a master's degree in public health. He has a decade of work experience in health policy and service delivery concerning reproductive, maternal, newborn and adolescent health, nutrition, and infectious diseases. He joined the World Health Organization Philippines in 2019 and currently serves as the technical coordinator for adolescent health, family planning, and maternal and child nutrition. Our fifth panelist for today is Ms. Alice Encoroy. Alice Encoroy joined Unicef Philippines as its nutrition manager in October 2019. Before joining Unicef Philippines, she worked with the USAID FHI 360 Food and Nutrition Technical Assistance Project, or FANTA, serving as a country manager for Ghana and Malawi. Alice holds a master's degree in medical science, human nutrition, from the University of Glasgow, Scotland, UK, and a bachelor's degree in food, nutrition, and dietetics from Kenyatta University in Kenya. She has 20 years of experience in designing, implementing, managing, and providing technical assistance to nutrition programs across Africa and Asia. Back to you, Doc Mian.
Thank you, Doc Aina. A reminder to our participants, our Q&A box is wide open for your questions. Please direct them if you have a specific either speaker, Dr. Baker, or the panelists to address your questions to. Please feel free to do so. And now may I call on Mr. Eugene from WHO Philippines.
Thank you. Thank you very much, Dr. Mian. Just I need to turn off my camera to say first of all, I would like to congratulate and thank to those who work hard for this study. It's very helpful for our breastfeeding advocacy in the Philippines. But allow me to highlight that Philippines is always at the forefront of breastfeeding initiatives. The Philippines is one of the first countries to adopt the Philippine Milk Code, which strengthened the promotion of breastfeeding and proper nutrition, and strictly regulated the marketing and promotion of PMS. Our country also pioneered the Rooming In of the Republic Act 7600, or the Rooming In Breastfeeding Act of 1992, which encouraged the practice of breastfeeding in government and private institutions. And also to mention our first 1,000 days law in the Philippines. Because of the global and local rise of CMF, we should continue to be vigilant in ensuring that our breastfeeding policies and IYCF is being implemented nationwide. As mentioned by Dr. Baker and the Secretary earlier, we need to safeguard our breastfeeding policies. As advocates, it is our duty to promote breastfeeding and IYCF and to supervise and monitor the compliance of all health facilities, public and private, and even in the community, to the policies and guidelines on breastfeeding and IYCF. The World Health Organization actually is continuously working with the Department of Health and agencies to adopt new measures to support breastfeeding mothers, including strengthening systems and service delivery. We always remember that, of course, breastfeeding remains the single most effective intervention that can save the lives of newborn babies. So, as we gather here, this breastfeeding forum, let us continue to push for breastfeeding in the Philippines and across the region. That's all, and thank you very much.
Maraming salamat, Mr. Eugene, as WHO Philippines presenting their role as curator of standard practices in promoting and protecting the health of mothers and children. Now I'd like to call on our partner from Unicef, Ma'am Alice.
Thank you. Thank you very much, Dr. Sylvester Mien. Now, for several decades, as we've heard from other speakers, the Philippines has had one of the most robust legal frameworks on the Milk Code. We know this has had many challenges along the way and a lot of lessons learned that we've had and that are not only useful to the Philippines, but also very useful to the globally to the world. I think we've seen that the marketing and tactics from the food industry to promote commercial milk formula continue to evolve and to be more aggressive over and over. I think one of the key factors that we've seen that is highlighted not only in the Philippines, but in other countries around the world is the fact that the health system, health workers, as well as professional association, nutrition or health professional associations are often being used to channel this promotion and to market some of these breast milk products and substitutes as well, which fail which are not really compliant or they're not within the scope of the code. So I think it is really our urge from UNICEF and all partners to see how health workers and this association can continue to promote and support breastfeeding. We know, I think we don't need to repeat, but it has immense benefits to the baby, the mother, and the broader health benefits. So it's really critical for us to continue promoting breastfeeding. We've seen actually for all of us, I think I'm sure we are very much aware, we've seen that especially during emergencies in the COVID-19 pandemic, we saw a high increase in terms of promoting and marketing of breast milk substitute to parents and caregivers. So I think it's really important for us to really stay vigilant and really continue advocating for the best for our children. Philippines has made a lot of efforts with the Milk Code, and again, just re-emphasizing the need to continue being vigilant, advocating and supporting the legal frameworks that are already in place. Very critical in terms of continuing to equip our legislators. I think we've heard that these tactics are changing, they're evolving. So very important to continue equipping our legislators, policymakers, and champions that we've been working with in terms of the new evidence on breastfeeding and why it's really critical to the country. And also putting in place some of the robust systems to monitor compliance and to take actions in terms of some of these violations that are taking place, both at the local and the national level. I think more and more we see a lot of these violations happening at the local level, as I think Usek Baher highlighted. The Philippines is decentralized. So when we get to the local level, then we really need to build the capacity of local government units to be able to create that understanding on the Milk Code and also the provisions within the Milk Code, and also helping in terms of coming up with compliance or local ordinances that can help in terms of monitoring as well as regulating at the local level. Also very critical in terms of increased investment, again, for continued protection and promotion of breastfeeding for us to reach that target of 50%. As UNICEF, we continue to work with WHO, with the government, civil society organizations in terms of promoting and protecting breastfeeding through advocacy and support to the government on monitoring of the code, policy development, and even development of implementation plans that can help to operationalize the code all the way to the local level, capacity building of the local government units and provisions around the provisions that are there, including social behavior change for mothers, as well as educating or providing more information to the mothers to make sure that it's very clear in terms of what the code is and the benefits as well of breastfeeding. And very critical is continuing and amplifying our advocacy efforts, and capacity building cannot be overemphasized. We really need to, evidence is coming up, is just how we continue really creating that awareness and education around the provisions as well as the benefits of breastfeeding to the nation, more or less at all. Thank you, and I'll pass it on to you. Thank you.
Thank you, Ma'am Alice. Thank you very much. Allow me first to, since Ma'am Alice was the last panelist to speak, and now we're proceeding on to the open forum. Can I, if you would allow me to take off from the points that Ma'am Alice mentioned and direct this question to Philip. Dr. Baker, you went into a deep dive. You went into a deep dive, and we commend you and your co-authors for the breadth and depth of your work over these last years. Could you, Dr. Philip, in the course of the Philippine case study, what would you pinpoint as maybe one or two of the most valuable lessons that you derived from the Philippines that maybe other countries can take off, bring with them when they dive into their own efforts on this huge problem? Dr. Philip?
Thank you for that. That's a really wonderful question, and thank you so much for asking it. I'd just like to make 3 points. The first point is that the global community, and I think many coalitions, advocates in countries focus on the marketing practices and ensuring compliance with regulation. And that seems to, really dominate the research, it really dominates the policy discussions. And of course, that's really important. However, I think what our research really points to is just how crucial it is to pay attention to these political activities of the industry as well. And the reason why we are not seeing a continuation of strengthening of national milk codes, the reason why we are not seeing full implementation of the International Code of Marketing, international laws, is very much related to these political activities of the industry. So I think we need to shift the conversation to also include how we limit that political influence of the industry. What do we need to do? Is it similar to what Benedict was saying earlier about the Framework Convention on Tobacco Control? Do we need an Article 5.3 for the baby food industry? Should we protect policy processes from the influence of the industry? So that's number one. The second point is how important these national breastfeeding coalitions are, and also how important it is to have an active civil society mobilized around these issues, which is advocating for, on behalf, and includes women and mothers. And I think we often, in public health, we tend to think about this as a technical problem, and we can, do systems optimization, we can do technical work to try and address this problem, but it's also very much a political problem and a political challenge. And this mobilization of these coalitions, of the advocacy groups, should be thought of as a public health intervention. So when we are resourcing, when we are funding breastfeeding, infant and young child feeding work within a country, directing resources to these coalitions, to these advocacy groups, making resources available to them, providing them with opportunities to develop strategic capacities, leadership capacities, is really crucial. That is an intervention. That is an intervention for breastfeeding. So that's the second point. The third point is that we are using the systems framing. So the term first food systems is to recognize and acknowledge that there are many determinants influencing infant and young child feeding within a country. And if we are just doing some interventions in that system, but ignoring other parts of the system, we're not going to make a big impact on breastfeeding. So some marketing restrictions on BMS products, yes, they're important. But we also need to tackle the governance issues, the political issues, like I've just said, the influence of the industry. But we also very much need to resource women themselves. And we need to acknowledge that breastfeeding requires time. It requires, it is a form of work. It's a productive activity that women do. And we need to resource that through things like, comprehensive and paid maternity leave, maternity protection, for example. So, sorry, it's a very long, complex answer. But so, yeah, tackle the political influence of the industry, number one, resources for breastfeeding coalitions, number two, and think about this in terms of systems and how we can act across the entire system to improve breastfeeding, number three. Thank you.
Okay, thank you. Boy, am I glad that I'm so relieved that I'm not going to make the synthesis. Doc Aina, you have your work cut out for you. Thank you, Philip. If I may call you Philip. Okay, I wanted to start on a positive note with the lessons that the Philippines can give to the world, so to speak. So before I went into our questions in the Q&A box, which actually are, as I see them here, many are already in the actual implementation. So thank you, Dr. Baker, Phil. May I start off with a question to Dr. Beverly? Director Bev, the question from a mother support group. What policies or programs does the Health Promotion Bureau have to build the capacities and empowerment of the civil society organizations? Precisely the empowerment that Dr. Baker is talking about in the advocacy of IYCF. What can you suggest we, they, me included as mother support groups, do so we can have an active hand in the promotion, support, and protection of breastfeeding? Doc Bev first, and anybody else if you would like to contribute. But I think Doc Bev would be the most is the addressee of this question. Director Bev. Dr. Bev? Okay. Doc Bev, you're on mute. Doc Bev, what policies or programs does Health Promotion Bureau have to build the capacities and empowerment of the civil society organizations? One example of this empowerment is what happened actually during the COVID-19 pandemic, in the early months of the pandemic, when a policy of separation was what the knee-jerk reaction to the pandemic lockdowns were. Doc Bev? Doc Bev? Okay, Janice. Janice, is Doc Bev still in the house? I see her in the co-host.
Yes, Doc, yeah, she's still here, but we will check. Maybe she step up for a bit.
Okay, let me field another question first. From another civil society organization, Dr. Kapili, slowly reading through the study now and just at methods, it is quite striking that the fallout in interviewees is high. 15 out of the 32 invitees, also given that the method is that of snowballing. That I find odd. Were professional organizations invited and did they participate? So let's direct the question to Dr. Baker. So
Thanks for that.
Thank
you for that question. Yeah, so this is a standard case study research design and process tracing method. And so we, as part of this design, we draw upon lots of different sources of evidence. And the approach is to really triangulate as much evidence as possible. So to confirm what we're finding through multiple points of evidence rather than just one source of evidence. So for this study, we relied pretty extensively on documentary evidence. So hundreds of documents, I should say, first of all. The second were interviews with stakeholders in the Philippines. That's really important because we want to run these questions past people from government, people from the private sector and industry, people from international organizations, people from civil society groups, academics, and the 17 people we interviewed were from across those different sectors. Now, when you go to recruit people to do interviews, you tend to get a response rate. In this case, the response rate wasn't that great. We had a lot of non-responses from different people in different sectors, government, international organizations, the private sector. Most of the private sector people we invited did not accept our invitation to be interviewed, and we did not manage to interview any professional organizations either. Although we did interview a number of medically qualified people, none of those were representing a professional organization, so to speak, in the Philippines. But snowballing is a standard recruitment technique. It's used in lots and lots of studies. If you have expertise in qualitative research methods, snowballing is a very commonly used recruitment method.
Yes.
Thanks. Thank you.
So, yes, I think the question was specifically querying about professional organizations having been invited and or consenting to participate, and apparently not directly as representatives of their organizations. Okay, taking off on empowerment of mother support groups, there's a follow-through question here, and I think this might be directed to Dr. Bev again. Are there concrete steps being taken towards the institutionalization of mother support groups, whether as part of the organized IYCF groups that arise organically from concerned volunteer MSGs into the health system for IYCF? So if Dr. Bev is around, Ms. Janice or Ms. Crystal? Maybe not. I don't see Director Bev.
Yes, Dr. Mian, Director Bev is now offline.
Okay, so she had to leave. I'm going to leave that question for now because it is a question that Director Bev's Bureau of would have been best able to answer. So let's go temporarily to China, with the question of Dr. Mads Parawan of Save the Children. A BMS company in China featured by Cable News Network is also coming in with powdered breast milk. What is the insight of our panelists regarding this new product, powdered breast milk, which to Dr. Parawan is another strategy of milk companies? I suppose this is open to any of our panelists, maybe Unicef. Ma'am Alice, would you have any response? Have you heard of this new supposed innovation into powdering breast milk? Ma'am Alice, can I pick your brains on this? Can we pick your brains on this? Oops, Janice, is Ma'am Alice here? If
Alice had to leave for another meeting.
Alice had to leave. Is anybody on the panel, or even Philip? Could you venture your insights into this new supposed innovation on powdering and putting into powder form breast milk?
Yeah, so thanks for that question. Yeah, so this is sort of something that's happening in lots of different parts of the food system, coming up with, you know, like it's the same in the protein industry, coming up with meat analogs, you know, cell cultured meat. And we're seeing this in the infant feeding space as well. Lab produced breast milk, something that's being invested in. These powdered breast milks, I'm not familiar with this particular story, but I'm assuming this is a product that involves sourcing breast milk from lactating women as suppliers and preparing that as a powdered product. These products are covered by the code. Actually, I think Julie Smith has just actually said that in the comments. So they are effectively breast milk substitutes. And of course, they don't, you know, look, I probably shouldn't comment too much more on that, but I'll just say that the industry, when you look at our papers that we've been writing recently, what becomes very clear to us is that the industry will do whatever it can to make money. And as part of that corporate strategy, the industry invents lots of new products. So we used to have just infant formula. Then we had follow-up formula. Then we had toddler milks and growing up milks. And now we have lots and lots and lots of different specialized milks, therapeutic milks. And this is a way for the industry to grow sales. We even have, you know, milks for pregnant mothers, for lactating mothers. We have Bear brand milk in the Philippines for older children and adolescents. We have milks for the elderly and geriatric, you know, so the industry keeps expanding its product range. And I think this is just another part of that. It's just another way to commodify infant and young child feeding. And, you know, we need to push back against it because at the end of the day, we want breastfeeding. And it doesn't matter what the product is. As long as it's covered under, you know, the code, and we don't want to you know, support it.
Okay.
Thanks.
Maybe a very quick addition. Sorry, this is Paul. Hello. Just a very quick addition to Phil's comment. Again, I'm not familiar with the article and the specific product, but just the name itself, that is the name being thrown around, powdered breast milk. Then it already implies that it's an equal product to breast milk, and that alone would make it, for many other reasons, including that it would be covered by the code, and there's no reason for it to not be. So just a quick addition to Phil's comment.
Okay, thank you, Paul. Paul concurs with Philip and Julie. That a powdered breast milk product would still be covered by the code because it's being marketed as a breast milk substitute. Taking off on that, any comments on human milk fortifiers? Human milk fortifiers are being marketed to be added to breast milk, supposedly to supplement calcium and phosphorus levels, supplies, and or other calories. Any comments on human milk fortifiers? If not, then I'm sorry, maybe this last question, am I correct, Doc Aina? One question for Attorney Nisperos, and then I'd like to ask one question from Ms. Eileen. Okay, Attorney Ben first. How can mother support groups or CSOs lobby or effectively lobby for policies that protect the milk code or promote non-interference? So how can mother support groups make their advocacy actions more effective? Are there cases we can put up against professional organizations for allowing milk companies support? On a local level, how can we protect the milk code and lobby for the strengthening of protection from milk code violations within the LGU? And who lobbies or protects breastfeeding up there at the national legislative level? Attorney Ben.
It's a very interesting, it's a complicated question regarding lobbying. But lobbying per se, it's a large activity itself, and it involves a lot of resources, time, and coordination and all. So I'll just share on based on the experience of health justice. In terms of lobbying, first we have to identify which committees are handling policies that regulate milk products, and direct our lobbying efforts to the legislators who are involved on these products. It could be the Committee on Health and Committee on Trade. The groups should identify that, and they have to register their participation by issuing policy papers and position statements to these offices in Congress. And then you can also lobby with the executive side, that's with our regulators, our government, and at the highest level could be the president. And for our experience, when we lobby with the president, since he's somehow into public health policies for the past, in terms of his record, he hears on public health policies that can be beneficial to children and mothers. In terms of our tobacco control advocacy, we have the Parents Against Vape, and we actively lobby also by voicing out our concerns in the media. Just last week, we conducted a forum on our call for the veto of the vape bill. The parents and mothers and all those stakeholder groups that are interested with this advocacy can group together and launch something like that, and tap directly media practitioners who can comment, who are known to be public health advocates, and who can really be the voice, or can translate the voice of mothers on this issue. And then finally, in terms of the network, we have to expand our network, because the larger the voice is, the more that it is heard by our regulators, our policymakers. And if we also network to other organizations, other industries, that also expands, and makes our voices heard by the decision makers in our country.
Thank you, Attorney Ben. So from Nadine Casino, I'm sure you took down notes on some of those options that you can take to be able to push your advocacies more effectively. I lied. One question for Miss Eileen. Could you, actually you did mention, but it's more of a comment because of all the discussion so far. You probably are the only one who talked about internal regulation. Most of what has been talked about was external regulation from the state, no? Can you reiterate how you, as your Association of Medical Students, envision your role to be now? Eileen? I don't want to put you on the spot, but just to reiterate what you said and maybe your realizations.
Well, from that, I think as the national officer of my organization, we do have a role in promoting such an advocacy. So one of it is that we would want to promote positive attitude towards breastfeeding by preserving and reestablishing breastfeeding cultures in the Philippines. On top of that, I think we can promote these advocacies and partake in campaigns that raise awareness in the general population and healthcare professionals around the benefits of breastfeeding, the role of the industry, and the medical and social barriers of breastfeeding faced by women. So in relation to this, one of my roles as the officer for the organization is that we do have campaigns such as infographic online campaigns such as for breastfeeding. We also have capacity building sessions on our different focus areas or advocacies. And with that project, we invite medical students and the general public to attend our events for them to learn more of our advocacy.
Thank you, Ms. Eileen. Thank you. They say behavioral change takes generations to effect, but I'm so hopeful right now that even while I'm still alive, while our generation is still alive, that we might still be able to see these changes. I think maybe a last question to Dr. Baker. Phil, in the upcoming World Health Assembly, is that this year or next year?
It'll be this year in
this year, correct? Yes.
In May, yeah.
Yes. Is there any plan to raise the issue of exploitative marketing in the WHA this year?
Well, that's a good question. I haven't been keeping abreast of, so the World Health Assembly is held in May every year, and every 2 years on a biannual basis, they address child and maternal nutrition, including, that's when they typically do they pass the resolution to update the code. This year is one of those years. The last updates were in 2018 and 2020. So 2022 should be a year where they table, and I know for sure that marketing of breast milk substitutes is on the agenda. And I mean, please don't quote me. I could be incorrect, but I believe digital marketing is an issue that will be tabled for discussion. And I believe there are also some other issues to be considered as well, but I'm a little bit vague on what those are. Thank you.
Yes. Thank you, Dr. Baker. It's these digital platforms that constitute the technical or legal loopholes that we aren't able to cover, to tighten. Okay, so I think our time is up for question and answer. If there are no more compelling questions there, I'd like to turn over the floor to Doc Aina. Doc Aina, thank you very much to Dr. Baker and all our panelists and all the participants who typed in their very relevant questions. Maraming salamat.
Thank you, Doc Mian. At this point, we will, may I call on Dr. Paul Andrew Zambrano, Regional Technical Advisor of Alive and Thrive Southeast Asia, to present the certificates of appreciation to our speakers and panelists. Dr. Paul.
Thanks, Dr. Aina. Are you hearing me well?
Yes.
Okay.
Loud and clear.
Okay, great. So, on behalf of the Philippine Coalition of Advocates for Nutrition Security and Alive and Thrive Southeast Asia, we would like to present this certificate of appreciation to our speakers and panelists in grateful acknowledgement and sincere appreciation for having spent their time and share their their knowledge and experience with us in this afternoon. Our forum is entitled Breastfeeding, First Food Systems and Corporate Power, a case study on the market and political practices of the transnational baby food industry and public health resistance in the Philippines. And I'm pretty sure all who are in attendance have benefited greatly from all your contributions. So given on the 17th day of March 2022 in Manila, we'd like to first give our certificate to Dr. Philip Baker and to Undersecretary Maria Rosario Singh-Vergere of the Department of Health, to Dr. Beverly Ho, also of the Department of Health, to Attorney Benedict Nisperos from Health Justice, Dr. Eileen Alcaraz, I am promoting you, you are now a doctor, Mr. Eugene Ardiz from WHO Philippines, Ms. Alice Sencoroy from Unicef Philippines, and also I'd like to appreciate the contribution of our moderator, Dr. Mian Silvestre, and our Master of Ceremonies, Dr. Mary Christine Castro from NCT, but also representing Philcan. So thank you to our panelists and speakers and our moderators. Back to you, Dr. Aina.
Thank you, Dr. Paul. So I will just give, at this point, I'll just give a brief synthesis. And as Doc Mian said, it is a challenge to synthesize all the points that were raised and discussed during our forum this afternoon. So I hope I give justice to the discussion. We started off this afternoon with Dr. Baker giving us an in-depth historical view of the marketing and lobbying activities of the formula milk industry in the Philippines, along with their global and local allies. He walked us through the details they have unearthed during the study on the use by these lobby groups of progressive sounding words such as freedom of choice and women's empowerment to push the sales of commercial milk formula products. The use of direct litigation and threat of arbitration using the framework of trade agreements that actually favor trans or multinational corporations, and the more recent tactic of forging partnerships and government connections. On the other hand, Dr. Baker also mentioned that the Philippines is a lighthouse country, being one of the only 25 countries with national legislation that is substantially aligned with the International Code of Marketing of Breast Milk Substitutes. And he attributed the achievement of this to the following: a strong political commitment, continued efforts towards building coalitions, supporting and promoting breastfeeding over more than 4 decades, and civil society mobilization and transnational activism. He also mentioned that it's important to not just be evidence-based, but principles-based in our advocacy. The DOH statement presented by Dr. Yusek Vergere emphasized the challenges faced by the DOH in implementing the milk code, including challenges posed by decentralized system of government, the frequent natural and man-made calamities that are used as entry points by the CMF industry, and the growing CMF industry and different tactics to undermine the code. But lastly, she also recognized the important role of Filipino women and breastfeeding advocates in realizing a fuller implementation of the milk code and related laws in collaboration with the efforts of the Department of Health. During the panel discussion, we heard about the roles of different sectors in protecting, supporting, and promoting breastfeeding. So Dr. Ho also mentioned that the DOH Health Promotions Bureau is currently working on streamlining the guidelines for frontline workers such that the guidelines will not be confusing to the different frontline workers. The development partners, WHO and Unicef, advocated for a greater and deeper understanding of the milk code among different actors. including pushing for local ordinances and regulation at the local level. Also mentioned was the need for increased investments in breastfeeding promotion, capacity building, and advocacy at different levels. We also heard about the role of civil society and health and allied health professionals and students. The parallelism between the tactics used by TNCs in different industries, such as the tobacco industry and the commercial milk formula industry, which include industry interference in policymaking and efforts to manage their reputations, must be made well known to the different actors in civil society for advocating for breastfeeding promotion. We need to remain vigilant and consistently oppose any and all efforts to undermine breastfeeding. Best practices in the struggle against the tobacco industry were also shared, such as having a policy preventing conflict of interest and the rejection of policy proposals and technical assistance from industry, as well as continuing to raise awareness and to expand the network and collaboration with civil society organizations. The important role of health and allied health professionals and students was also brought up, as they have direct contact with mothers and caregivers in the healthcare system and are seen as reliable sources of information. Therefore, health professionals should be independent, and professional advice that they give should be based on evidence. The breastfeeding coalitions have been active in the Philippines for decades and have already gained some victories. The people and faces may have changed, but the commitment remains the same. So we welcome the younger actors in the BF coalitions, the tech-savvy mothers in the mother support groups, the medical and allied health students who are joining these coalitions, and we hope will continue the tradition of commitment to breastfeeding. Lastly, Dr. Baker also reminded us to frame breastfeeding as a food systems and a political issue. One of my takeaways here is that breastfeeding is the first food system. It is the shortest supply chain and should be framed as part of sustainable development. In this context, we need to empower and make sure that advocacy coalitions are well resourced and to take steps to curb the political power of industry and not neglect the political practices of the CMF industry when planning policy actions. So that's all I have for the synthesis. At this point, I would like to call on, again, Dr. Paul Zambrano to give the closing remarks.
Thank you, Dr. Aina. You had the most difficult job of all, I think, and maybe I have the fourth most difficult job because my script for my closing remarks, I think, changed maybe 20 times since the start of the webinar. It's because so many great points were raised, and I don't want to lose some of it. I think we need to send off our participants in this webinar with these key messages in mind. So before I go to my very few slides, I would like to thank again DOH for their participation and support, and of course to Yusek Ferreira, who is one of our study co-authors. Thank you to Phil Khan for organizing this webinar with us. Thank you to Phil for spending his time and sharing the findings of our paper. Thank you to our panelists, reactors, for enriching our discussion. And thank you to all of you who are still with us, even if you've had to leave early. Thank you for sharing your time with us, and we hope you continue to stay engaged in this important advocacy discussion. So our study is, I think, is both a look back and a look forward. One of the things we hope that we could achieve is to have a document that would help have institutional memory. So 20 years from now, the struggle and ongoing advocacy and efforts by everyone to protect the code and to protect breastfeeding will not be forgotten or will not be relegated to distant memory when the inevitable happens and people who are involved shift out or transfer or otherwise engage with other responsibilities. And I think we've somehow succeeded in doing that. And also highlight the point that this is not what we've seen is, yes, does occur in the Philippines, but it's very similar to the experience of many other countries. In fact, that's why we have this whole advocacy on commercial determinants of health, and the evidence from different parts of the world continues to mount. It continues to gather momentum because this issue of exploitative marketing and its effect on health is becoming to be more appreciated and recognized as a major public health issue. But I think one of the two key words of the title of our paper is not only the practices of the industry, but resistance. How our partners, how our government resisted, and how 40 years from the signing of the code and many decades since the Philippines had its own code, why we still are one of the lighthouse countries. So it's also a success story of this resistance. But looking forward, which is one of the things we want to highlight, what form should this resistance now take? As the USEC and Phil said, the tactics of the industry continue to evolve and we must adapt with it. How we resist should be adapted. Who is part of our coalitions should be adapted. Should we involve our medical students more? Should we involve our professional associations more and engage rather than be more engaging than confrontational? So there's a lot of steps, but if you can go to the next slide, Janice, the report of WHO gives us a summary of action points that I think are very relevant for the Philippines. And I'll go through them very quickly. One is we need to recognize the scale and urgency of the problem. Our paper that we just presented gives you a flavor of just how the depth, the breadth, and the depth of this problem is. And we hope that now, when we say marketing of commercial milk formula in the Philippines, you don't only talk about advertisements, you talk about the political practices and everything as well. Next slide. Legislate, regulate, enforce. Philippines did number 1 and 2 very well, and as Beverly said, number 3 has a lot of room for improvement. So it's not just the code. We need other policy action that helps to regulate the other forms of marketing. Next slide. Protect the integrity of science and medicine. As a doctor of medicine, this speaks strongly to me. Health professionals and their associations have long been part of the problem, not necessarily because we are actively creating this conflict of interest, but many times, and in the Philippines as well, it's been ingrained culturally that it's normal for us to engage with the formula milk companies, and something really has to change. And for us, we need to be grounded in our sworn responsibility to do no harm, and in our sworn responsibility to act in line with our ethical obligations. Next slide, please. Okay, 4, Phil mentioned that this might be an area of emphasis in the upcoming discussions in the World Health Assembly. So digital is not a new form of marketing. It's a new technology that enables other forms of marketing to be more powerful and to be more insidious and to be more damaging and to be more effective. Number 5. This is a message for investors. Instead of investing in companies that compromise public health, they need to invest in mothers and families and divest from formula milk companies. We don't know yet the landscape for this in the Philippines. Maybe it's a concrete action that the coalitions can take to do a mapping of the investors that we can approach. For example, Norway and their sovereign wealth fund divested from investments in formula milk companies. This is in recognition of the economic impact of breastfeeding and the economic impact of not breastfeeding. And lastly, expand coalitions. So again, for the Philippines, when we say coalitions, are we speaking about the same people again, sitting around or do we open our door to engage others? And the tobacco control experience that was shared by Ben showed that there is a lot of value in engaging our other partners who can support us in this. Are we engaging the medical professionals in pre-service training more? Are we engaging our advocates on gender and women's rights more? Should we be doing that a lot more in our looking forward? So questions for us to answer. I think that's my last slide, but let me just close. Let me just bring it back to a personal closing. No? So I recently am back from paternity leave. I had my third baby born around 2 months ago. So despite all my efforts all our efforts to try to evade or any exposure to BMS marketing, it's so difficult. The moment you go online, the moment you go out, the moment you open your television, it's there. So despite your best efforts, the system knows that you have a baby. The system knows that you can be influenced. It knows that you have decisions to make, and they can sway that decision towards one where they profit from your desire and your love for your child. And it's something I do not want for my children. It's something I do not want for any of our children. And I'm sure we share that sentiment and we share that value. So just going back on Phil's message, let's use our ethics, let's use our desire to do good, let's use our morality and support it with evidence and work together in a more cohesive, structured way. And let's do our best to gradually, slowly but surely, end exploitative marketing for our children. On behalf of Alive and Thrive, many thanks to everyone. Back to you, Doc Aina.
Thank you, Dr. Paul, and I'd like to thank everyone, the speakers, our panelists, and our audience for actively participating in our forum, dissemination forum this afternoon. So a good afternoon, good morning, or good evening to everyone, and we hope to see you in future activities. Please read and share the very informative article written by Dr. Phil Baker and co-authors. Thank you. Maraming salamat po sa lahat. Magandang hapon po.